TikTok nurses, love them or hate them, they're everywhere. But are they actually helping the profession, or are they just looking for clout? Today, I'm breaking it all down because there's a lot to unpack here. So let's talk about it. If we haven't met yet, my name is Josel James. I'm a nurse, speaker, and content creator. I have over 10 years experience in the ER, ICU, oncology, and also as a travel nurse. I share insights about nursing, healthcare, mental health, and everything in between. If that's something you vibe with, then please don't forget to subscribe to see more content. And if you're coming back, welcome back. Happy you're here. So let's do a deep dive into this topic from both a nurse's and creator's perspective. So TikTok nurses, these are healthcare workers who share snippets of their lives on the internet. Some focus on humor, like recreating funny patient interactions or interactions with a doctor or interactions with a pharmacy. Others use their platform for education purposes, like explaining medical terms, diagnoses, or even nursing school tips and hacks. But then there's that part that catches the most attention. The dances, the lip syncs, and the viral trends, all while in scrubs or even in the hospital. These nurses are becoming influencers with huge followings. Some even have millions of followers like Nurse John or Nurse Blake, and it's creating a lot of buzz, both good and bad. First, let's talk about the positive impact of these TikTok nurses. I'm gonna go over 3. The first positive impact is humanizing healthcare. For years, people have just seen nurses as people who just take your vitals or give you meds. But because of TikTok and social media, these nurses are showing the world that we're real people with real personalities. And they're actually going over what the job actually is sometimes. They're also showing our personalities, our senses of humor, and our passion. To me, what's even cooler is that nurses from all across the world can talk about their experience. So it kind of gives us a nurse collective community. Nurses can talk about their low wages or their unsafe working conditions. East Coast nurses can compare what West Coast nursing is like. United States healthcare can talk about what European healthcare is like. It's given us a sense of this community that I think is really beautiful. How often can you learn about nursing practices from someone in your same role from halfway across the world? TikTok and social media makes that possible. Another positive impact of TikTok nurses is the educational content. Some nurses on TikTok break down complex medical information into easy to understand bite-sized videos. I think that's such a powerful way to educate people, and I know a lot of people are really into that. A lot of people like to follow some TikTok pages that are purely nursing practice, clinical guidelines, or clinical information. And they break it down in a way that's digestible and easy to understand. I think that's a great way to educate people. I remember there was a nurse that I saw teaching the general public on how to recognize signs and symptoms of a stroke. And that is potentially life-saving. So that's good work. That's doing good work. And the last positive aspect I'll go over is inspiring future nurses. Some of these TikTok nurses are inspiring the future generation of nurses. I see a lot of the comments that these nurses are getting. A lot of them are, "Oh, I want to be a nurse just because of you." That's huge. People are literally influencing others to become nurses. And we all know we need more nurses. Nursing can also seem intimidating. And TikTok has kind of bridged that gap because people didn't really know what nursing was before social media and TikTok. Like, I wish I saw TikToks when I was in nursing school where people really explain what's nursing really like. I wish I saw that. Then I wouldn't have been so caught off guard. And now we get to the controversy. The first one, privacy concerns. This is a big one. Filming at work. The privacy of hospitals is at stake. The privacy of patients is at stake. That's breaking federal law. Even if you're not including patient details or patient information, filming at the hospital can feel pretty invasive. Like, if you think about it too, from the patient's point of view, you're in pain, and then you look in the hall, you see that your nurse is filming TikTok dances. How would that make you feel? There was this viral video where a group of nurses were dancing in the hallway, and in the background, you can see a call light was on. Even if that patient didn't need help, or even if there was no patient in that room, that alone didn't sit right with people, because you're in the hospital, you're at work, filming TikToks. Another controversial topic is clout versus care. Are people really focused on being educational and trying to help other people, or are they just chasing likes? People just make content that's just so tone deaf. Dancing during code blues, dancing while the call light is on, or even telling the world that they measure Ativan with their feelings and don't go off doctor's orders. I don't know if people are being serious, but it just rubs the people the wrong way. And if the wrong people see it, people lose their jobs. Even if it's meant to be funny, it just fuels the stereotypes that nurses don't care about their patients. The next controversial topic is public perception. When the public sees one bad nurse, one bad TikTok, they start questioning all of us. It's not fair, but it happens. Remember that video about nursing icks? That video was so relatable. I totally understood where all those nurses were coming from, but that hurt our public perception as nurses. And of course, you're filming in scrubs of the hospital where you're not even trying to hide what hospital you're from. I think all those nurses lost their jobs, if I remember correctly. And remember, a lot of these TikToks, a lot of these influencers, they go viral and it gets seen by the public. Nursing is supposedly a trustworthy profession, but if we're out there doing weird things like TikToks and breaking the public's trust, then that's going to hurt our profession. But it's not just the general public. Managers are going to see it. Prospective managers are going to see it. Hospital boards are going to see it. And public health policymakers are going to see it. And they're going to be like, that's what nurses are doing? That's what we're paying them to do? These TikToks can hurt our credibility as nurses and can also lead to stricter workplace rules or policies. Then there's the ethical aspect of it. How do we balance expressing ourselves online, but at the same time protecting the integrity of our profession? It's a tough line to walk, and I don't think everyone gets it right. If you're recording at work, think about this. Does what you're posting add value, or can it wait till you get off the shift? Ask yourself, would you feel okay if your coworkers, your patients, or your managers saw this? Does it reflect well on me as a nurse or as a person? If the answer isn't a clear yes, maybe it's not worth posting. So for my opinion, for me, TikTok is a tool. And like any tool, it depends how you use it. If you're using it to educate or bring people joy, I think that's great. I do the same thing. I'm an entertainer. But when it comes to crossing the line of being unprofessional or breaking people's privacy, breaking patients' privacy, or breaking hospital policy, it can hurt all of us. As a nurse and as a creator, I get it. Sometimes we just need a creative outlet. And for me, social media and TikTok has been a great creative outlet for me. I also understand how important it is to keep the trustworthiness of our profession alive, to keep the integrity of the nursing profession moving forward. Being professional is very important to me. I know I joke around a lot. I make a lot of jokes about managers, make a lot of jokes about hospitals, I make a lot of jokes about CEOs. I make a lot of jokes about nursing. But at the end of the day, I consider myself very, very professional. I think it's important to maintain our trust with our patients. I think it's important to maintain our trust with our employers. I think it's important to maintain our trust with the general public. Trust is a foundation of our profession. So basically, use social media, use TikTok, keep creating. I love that people are creating, but please think twice about what you're posting because you're making the rest of us look bad. We're at a point where social media is part of our lives, whether we like it or not. I know TikTok might get banned, but there's Instagram, there's YouTube. So there's other places where these TikTok nurses are going to go to. Social media is here to stay. But instead of demonizing social media or running away from it, maybe we can use it to be a healthy form of creative outlet. Maybe we can use it to responsibly uplift the nursing profession. And maybe we can even use it to connect with people in very meaningful ways, people that we would not have otherwise connected with. I think ultimately we all want the same thing, to care for our patients while also being authentic to ourselves. It's just about finding the right balance. So what's your take on TikTok nurses? You think they're helping us look good, or are they hurting the profession? Drop your thoughts in the comments. I'd love to hear your thoughts. I'd love to hear your perspective. And if you're a nurse on TikTok or on social media, tell us your story. I really want to know what it's like from another creator's perspective. What's it like balancing content creation and patient care? Have you faced any backlash? I really want to hear your thoughts. I personally faced a little bit of backlash in the past about my videos. If you want to hear that story, drop a comment in the comment section. If this conversation got you thinking, hit that like button, share this video, and subscribe for more videos. Thank you for watching. Social media is what we make of it. So let's make it well. Thanks for watching. And as always, love you. Bye. Peace.